Are you dealing with elbow pain, in particular on the inside of the elbow? That's often called golfer's elbow. The technical term is going to be medial epicondylitis or medial epicondylosis, but you'll hear it as golfer's elbow. And then sometimes you have elbow pain and you'll get a blanket diagnosis of golfer's elbow, and it's not even that. So we want to make sure first we diagnose you correctly, and then from there make sure you're not, decreasing your ability to work, play certain sports, not just golf. There's other ones as well, like tennis, that it can be a problem with a forehand, or just even opening up a jar. And you don't want to have any types of long periods of rest or surgery. Hi, I'm Dr. Kevin Christie, and today I'm going to show you how we can evaluate and treat common conditions of the elbow, and I'm going to give you a few stretches and exercises to do to help prevent this, or even help you alleviate it if it's not too bad right now. A lot of times when people have elbow pain, it's a reaction site. So the pain is here, but a lot of times there's dysfunction in the shoulder and wrist. So we would do a functional assessment of the shoulder just to make sure there's nothing going on there. And a lot of times through our rehab, we're gonna address some shoulder dysfunction as well. But we're gonna go right into an evaluation of the elbow. And typically with medial epicondylitis or golfer's elbow, the pain's gonna be right into here. There's the attachment of the forearm flexors. And right here, a lot of times you'll have a lot of pain and inflammation, okay? And so we're gonna check that out. We're gonna palpate through the muscles. A lot of times there'll be some serious tightness that we can feel. Then we wanna rule out any type of orthopedic issues. We're gonna check the stability of the elbow joints and just making sure everything's good there. We know when to refer you out if there's some kind of orthopedic condition and you need a specialist. But once we can rule that out, we can try to rule in golfer's elbow, and that's by just palpation, obviously the history and consultation, some of the activities. But a lot of times you're gonna have pinpoint pain right into there, and that'll help us diagnose golfer's elbow. When we go into the treatment of this, we do various things in our office, but we're certified in active release techniques, and that's gonna be a soft tissue treatment, because what happens is oftentimes these muscles here get really tight and it just kind of tugs on the attachment with the tendon. So you've heard the word tendonitis before. There's actually a better word, tendinosis, and it's a little bit more of a degeneration of the area, but just envision that muscle being tight and the tendon that attaches the muscle to the bone is really tugging on that area and it gets irritated. So we really want to make sure that we get to release these muscles in here through the forearm flexors and even the pronator teres muscles. And I'm going to show you a stretch for that later. But a couple of active release technique moves look like this. We're going to get on the area that is tight and dysfunctional. Maybe there's a trigger point or scar tissue. We're going to get into a shortened position, and then we're going to lengthen it with a thumb contact on there, and we're going to get a really good release through there. So we're really trying to release that muscle group and try to get it to loosen up a little bit, for lack of a better term. And so we're going to go all through the forearm flexors into the pronator teres muscle, which runs like that. A lot of you out there typing a lot, not necessarily playing golf, are going to have elbow pain as well, and it's going to come from the typing motion just like that and all those muscles working. And so a pronator teres active release technique move is more like that, and then we rotate the arm out and we really get into there to release that muscle group just like that. And then lastly, we have something called Graston technique, which it's a stainless steel tool. It's got a little beveled edge there, and we can get a little bit of blood flow to the area. One of the keys to treating these types of tendon-related issues is getting blood flow. The blood flow is needed to heal the area, and without a lack of it, it's just gonna stay painful and injured. And so we're gonna get into there, and we would use a little bit of an emollient, and we're gonna get in and really break up some of the scar tissue with Graston, and we would get all the way through the whole entire musculature and also into there. And so that's a lot of the soft tissue work we're going to do for this condition. Next, I'm going to show you our laser therapy. For a lot of our elbow, foot, shoulder conditions, we use deep tissue laser therapy. Every cell in your body has the ability to heal itself, but sometimes it loses that tug-of-war battle with the stress you place on it. Light therapy, class 4 laser, has been proven to stimulate the mitochondria to help with cellular healing. And so having laser therapy on some of these musculoskeletal conditions can really help speed up your recovery. So when we're dealing with golfer's elbow, we're gonna do this for many of our treatment plans with patients, and we're gonna just basically get right into the area. We're gonna spend a few minutes, probably all the way through this area here and really get onto that elbow right where the attachment is, and trying to help speed up the recovery of your injuries. So deep tissue laser therapy has been proven to be a great way to help with some of these conditions, and we've found great results with our patients with this, especially with golfer's elbow. So we'll get right into these muscles all the way through. We don't want to spend too much time on a particular area, but we're going to get into there, and that'll help with the healing process. You don't feel too much during this, but it is working, and the results have been proven itself over years. I'm going to show you one stretch and one exercise for golfer's elbow. There's a lot of different things we would do in a clinical setting as part of your rehab process, and in our practice, we a lot of times do equal parts spinal manipulation for certain conditions. We do a lot of soft tissue muscle work, as you've seen, but we also do rehab. I can only give you some beginner level things to do at home because I don't know your particular situation, so we don't give you things that are safe but effective to help reduce and manage some of the pain you may have or help you prevent it. And so the first one I'm going to give you is just a simple stretch of the forearm flexors and that pronator teres that we talked about. And so you're going to take your fingers, you can do this seated or standing, you're going to extend the hand, and then you're going to extend the elbow, and then just rotate out slightly, and then you can hold that for 10 to 12 seconds, okay? And I would like for you to do both sides, even if it's just a right elbow issue you have, so do both. And then I want you to hold that 10 to 12 seconds, do 3 repetitions, and you can do that a few times throughout the day to really help loosen up all those muscles there on the forearm flexors. The next one I'm going to give you is an eccentric exercise. The term eccentric just means kind of on the way down, and the muscular contraction is doing that, whereas concentric is going to be more of your traditional, say like a biceps curl, where the eccentric component would be that way. And so you're just going to get into there at a nice light weight, figure out what's comfortable for you. If there's any pain on any of those, that is a sign to stop. And so with this one, we're going to really work on these forearm flexors to strengthen them. And you're just going to slowly, to about a count of 3, let that eccentrically contract that way, and then you'll come up. Good. And then you go again to about a count of 3 and go through there, and you'll start to see these muscles start to work a little bit. And you can do anywhere from 8 to 12 repetitions and 3 sets on each side, probably once or twice a day. And that's all variable depending on when we evaluate someone. But that's going to help strengthen that area. And then once you're starting to feel a little bit better, we would progress with more intermediate and advanced exercises to work on that area and strengthen it. Now that you've seen how we evaluated and treated golfer's elbow, and you like to get treated and evaluated in the same day, call our office at 561-997-8898, and we'll get you on a very short, concise treatment plan to rid you of your elbow pain.